It's a great pleasure to present our project, so the IT Future of Cancer project, which is financed under the Flagera call on personalized medicine to make a demonstrator about breast cancer. So how we could bring to the health professionals in the future new methods to better predict, diagnose and foresee how a patient may respond to the drugs. So what would be the best treatment for the patient to bring personalized therapy. So we have the chance to have a consortium with more than 17 partners coming from different countries and having the support of our national member states and to have the possibilities to deploy these demonstrators across different hospitals. And so we are working on that with our stakeholders, of course, with the state members and also the people in the consortium, to have the best data available for that, in the breast cancer area. Also to try to look at the different type of modeling approach that we can get, from mechanistic approach to machine learning approach and to different ways of taking care of the clinical questions you would like to ask, and to compare them in terms of sensitivity and specificity. In particular, we will be organizing a world contest to see the efficiency of the different type of modeling approach, working on the same reference test set and opening up to a wide range of the community, not only the people involved in IT Future of Cancer, not only the community of the flagship, for instance, our proposal of DigiTwins, not only the ecosystem within Europe, but also in the States, in Asia, because there is a lot of innovation, very interesting innovation that we should be able to use for the benefit of the health systems, the patient and the health professional. So I hope we will be able to give you very good news in 1.5 years at the end of our project, and it will be a beginning of other projects, of course, because we will need to validate them in clinics, and so we are looking after that to find new financing to give a chance to this solution to come to the patient and the health professional. Thank you very much, and thank you very much for your support.
In IT Future of Cancer, we are trying to develop new personalized therapy choice for cancer patients. This is on the way to a much larger project, Digital Twins for Better Health, in which we will try to expand the basic strategy which we are developing to make unavoidable mistakes also in medicine on computer models rather than on real patients, to many areas of medicine, prevention and well-being. In all areas except for medicine and drug development, we have learned that we cannot avoid making mistakes whenever we are faced with complex situations, but in all the other areas we have been able to avoid the consequences of these mistakes by modeling the situation on a computer and testing the effects of all possible reactions to this situation on the computer model. Therefore, we avoid the consequences by making the mistakes cheaply, quickly and safely on the computer rather than in reality.
In these days, there is a great interest in how to modify the way we attack diseases in order to improve much better the treatment of very heavy diseases like cancer or neurodegeneration that are a very heavy toll for families and people in Europe. The best way to be more innovative for the treatment of this disease appears to be the merging of the analysis at the molecular level, like the one that the genomics and omics technology generally do, with the construction of predictive models that allow to check both how things are going, so helping the diagnosis, but also to identify with some new knowledge that has to be built how new drugs or present drugs can be used for the maximal results. The project that we are talking about, ETFOC, and the one that is going to follow, we hope, the G-Twins, are just moving along this road, and they already have results obtained in different countries in Europe to indicate that this is the real important new way for attacking this terrible disease that so great effort require from the society and for the families and people. There is the possibility of creating new jobs because these new technologies require both work in innovation but also work in running on these new technologies. So Europe would not only gain a better quality of life for their citizens, but also the increase in economic competitiveness and new jobs, new qualified jobs that our young people require all over in the country, and especially in some countries like in Italy.
I am an Italian biochemist who is working in ETFOC in doing preclinical research, and I am looking forward for the results of this interesting project that will allow to bring a new approach to the development of therapeutic approaches in the field of cancer research. By doing preclinical research with particular three-dimensional cultures, we hope to get insight to the understanding of breast cancer and lead to the ability to test in an effective way a pipeline of work that may lead to development of better therapeutic approaches for breast cancer.
In this project, we are working on metabolomics, and we do metabolomics by NMR, whereas metabolomics can be also done by mass spec. NMR is less sensitive than mass spec, but has the great advantage that it's intrinsically quantitative, intrinsically untargeted, so you can do a single exam. If you think of body fluids like blood or urine, you can do a single exam in 15 minutes. It's relatively high throughput, and you can identify and quantify tens of metabolites, and altogether you can build a profile, or what we like to call a fingerprint. By doing this, you can actually identify people who are at risk of disease even before the disease is developed.
This project, we are going to work to change the future of the cancer patients. We want to do that by relying on a community of researchers that will build new models, on a network of hospitals that will collect data and evaluate the models. And then we will also work with a community of researchers in artificial intelligence to build new models that will integrate both the knowledge, the expert knowledge we have, and also to learn from all the data we can get from the hospitals.
I'm involved in research on bioinformatics and systems biology to integrate the huge amount of data that we have on patients in order to develop personalized and precision medicine approaches for different pathologies and diseases, in particular cancer. We are developing models of cellular and biochemical mechanisms and ICT tools to simulate in an efficient way these models in order to extract information from data, from the integration of the data we have.
In the last decades, there has been excellent progress in cancer care, but now we have also discovered that cancer is a completely individual disease. It's a relationship between the tumor and the patient, and to progress in treatment, we have to personalize this treatment. All the project ITFOC ambition is to prepare this personalization of the treatment, to identify the best signature, to identify the best treatment, and therefore provide the best care for the patient with biggest success and less side effects. And all we do in ITFOC is there. And we want to go to demonstrate this is feasible and then go further and find additional funding to go even further to enlarge to other cancer and other diseases. And we also want to find the best way to fund this therapy and this new examination we will have to make to find the best solution for the health system, for the population, and in general for health population.
So at Arrakis Theranostics, we work in data integration and data management. So in the ITFOC project, we collect all the experimental data and the drug response data, the modeling data, and we will connect these data in a data integration approach in a central database. This is a MySQL database, and we use standards for omics data to interconnect all these data to make it possible for the project participants to upload their data and also to download, to visualize the data. And then, of course, we will connect all these data to the modeling pipelines so that actual drug response predictions can be made. I think in the future we will also define standard data sets which can be used for the global drug response challenge with a defined data set and a known drug response that can then be used for the community.
Unfortunately, cancer has many faces. It's very heterogeneous, and so different patients need different medicine. Unfortunately, we have no means and possibilities to check this empirically in real time, which drugs will be the best. For this purpose, to overcome this, many different branch specialists in different fields, from metabolomics, genetics, genomics, IT, medicine, from very different European countries, has come together to create a virtual patient, a model which would allow to find in silico this the best, most optimal treatment for a particular person, and to save life of people, or at least to prolong their survival.
IT Future of Cancer treatment project has the potential to change the way the patients are treated by their medical doctors. Unfortunately, the medicine has some limits, and it's not the doctor's fault if they treat a patient without having the right outcome or the desired outcome of the treatment based on the best clinical protocols and keep clinical guidelines. But in the last years, technology helped us a lot in order to understand the disease, understand the treatment effects, and to help patients be treated very well. In this regard, IT Future of Cancer treatment approach is unique in the European space, and the project has the potential to provide a very useful tool to medical oncologists who have patients that has to be treated in very difficult condition, when the guidelines or the treatments available based on their indication are not sufficient enough. And for the future, this kind of approaches potentially will be used at a larger scale, not only for breast cancer, but also for other types of cancer and other diseases.